because the call we have heard the call. On August the 7th in Liberia, the Say No to Drug team, led by a powerful lady, Sonny, Carly, and her Say No to Drug team. They took on the streets of Monrovia in the pouring rain to say no to drugs. So tonight, the ULAA women and women all over the world, we're saying that we heard them cry, we saw them on that day, here today to connect, to match energy, and be able to say no to drugs in Liberia. So, ladies and gentlemen, tonight we're going to be doing all the things that I talked about, but most importantly, we're going to be doing it with love, we're going to be doing it with compassion, and we're going to be doing it with all hands on deck. Thank you. I welcome you. Sit back and enjoy the show. Liberia is at a crossroad. Thank you.
Wow. Thank you, Madam President, for such a powerful introduction remarks. Indeed, a thief cometh to steal, kill, and destroy. It's still your peace. It's still the truth that you need to know. It's still everything that we have. He gave you deception that a drug will make you forget about your troubles. Deception that you'll be on top of the war and the war will be honored. But today we have come so that the truth will be unveiled. So thanks for that remark. We now move on to special greetings by Manana, the Vice President of ULAA. You are welcome.
Please unmute yourself.
Thank you very much for that recognition. All protocol is there. I understand we have government officials from Liberia. I don't want to miss anybody, but we want to acknowledge you in a special way. And thank you for taking your time to be with us tonight. We also like to acknowledge the president of ULAA and other members of the administration here tonight to say thank you for taking your time. We also like to acknowledge Ms. Jose and her group, the Women Empowerment Committee as a whole, for such a very, very, very active position in this light and putting a light onto this program, onto the problem of Liberia. We acknowledge you, and ULAA as a whole appreciate all of you. Drug addiction, substance abuse, illicit substance abuse. Drug addiction is a disease. And therefore, ladies and gentlemen, we have to address it from that perspective. It's not in a process of weakness. Madam Chair, I heard you say about a million of people are impacted. The young people are impacted with this drug. But I want you to multiply that by 3. Because drug addiction affects the entire family. If one person is sick, is addicted, one person is diseased with the process of addiction, the entire family is impacted. And our Liberian society is in trouble. Our children's generation is in trouble. The generation after us is in trouble. Therefore, all hands must be placed on them. I'm happy tonight that the government officials are here and they will probably provide us some update on what's happening. But this is not a government problem. It's a societal problem. In this life, I want to call on all of us, women, men, church leaders, school administrators, college leadership, for all of us to sit down and discuss this thing. The process of addiction must be looked at in 3 different folds. One of the folds, the first one is the process of trafficking the illicit substance in our country. Where the drugs coming from? Is a drug that comes through Sierra Leone? Is the same drug that comes through Ivory Coast or Guinea or through the airport or the seaport? What is the forensic analysis of those drugs? And knowing the forensic analysis will lead us to medical treatment. What input? What's in other ones? In this country, in the country that we live in America, years ago, when they created methadone and Timbuktu, it was a particular kind of substance. the year go by, ladies and gentlemen, the people have to remanufacture some of that drugs because what is on now is not just heroin, it's fentanyl. We need forensics analysis to understand what is it that we're dealing with. Are we talking about methamphetamine or amphetamine? What are we dealing with? How do we address that? The second part of that goal is also the treatment. Are we talking inpatient, short-term, long-term, outpatient, case management services? Because drug addiction is a disease that people above us, people before us say there's no cure to it. It means it's a lifelong journey. Somebody go to rehab for 3 weeks, 4 weeks, and 5 weeks. They come back. We have to transfer them to outpatient services. We have to monitor them in the community. They clicked Ms. Toze's show earlier. You saw the young women. So other than the physical drug addiction that they experience, these women are going through ongoing abuse, sexual abuse. Those women will go on tomorrow and suffer all kinds of mental health issues. So these things have layers of it, and the treatment has to be comprehensive. The last one will be the outpatient that includes the education. That education includes schools, colleges, communities, churches, men, women, police department, DEA. All of us here who live in America, the biggest mistake police make here, they're not trained as social workers. When people are putting in influence police, I also remember there has to be a level of cultural sensitivity. Some of what we do here in America may not apply in Liberia, and we have to understand that. We also have to understand that there are people in Liberia that have made significant efforts over the past few months, several years, maybe years. We have to go there and collaborate with them. It's the mother church that these things we talk about. We are not just people, because they started the process. We only come to enhance the process. Not to take all the time because I want to respect us so other speakers can come. I will close by saying it's a nationwide process. It's a nationwide process. Those of us who are mothers, who have nieces and nephews, what do you say to your niece or your nephew or your son or your daughter? And she comes to you and says, hey mom, I'm addicted. I think I'm having a problem with this substance. What can we do to protect that mother? To provide her the resources so she can support her family. It's a nationwide problem. If a mother goes to a pastor's church, to a pastor and says, Pastor, my son is suffering. He has problems. What resources can we give the pastor? What evidence-based resource that we can give the pastor so the pastor can help to support that family? So, ladies and gentlemen, again, I'd like to thank the organizers of this program tonight. It's the beginning of many conversations. We appreciate all of us. So thanks for coming wherever you are. Good night, good morning. Let's engage. I thank you.
All right, thanks, Malanambi. We appreciate that. That was really that explained what we are going through the situation. Ladies and gentlemen, and representing the leadership of our broader community, we are honored to acknowledge the presence of the President of the Liberian America, ULAA, Honorable Mohammed Keita. Honorable Keita, you are welcome.
Thank you so much. Appreciate everything here tonight, and especially to our visitor here tonight. And we take this stand, and I stand on the ground for the previous speaker, the ball protocol itself. I don't want to take it up to like wrong with me. Thank you so much, even always. I want to believe in whatever we want to do. Touch is always the best. That's why you're here. We trust we know he can do better for us. But here's the thing. I would say this right now after camera, you will come in. The drug addiction is there. The treatment is there. But those who bring the drug in our country, those who know government, and I was listening to the video right now, it touched me, I almost cried. When a young man said that the government, the people in the government, some of the government officials, I don't say took it from the president mouth. This is what is there. We better this. This is very important. Help us. Because for everything you do, it will prevent it from money, money. It's not going to benefit. It comes to strong life. You're set to live. No way. So, but I want this. And that's why, we'll go to Nigeria. I'm not going to just sit down here and be on a video to talk to you. We'll be there. We'll ensure we plan a call for healing and recovery. We'll be on the right this year. One of the women will be there to make sure that our doctors, our nurses, our nurse practitioner, you know, and our people tonight, the jail in the already said it. There's so much for anything. Council funding, that job, help us, anything, because something like this. It's a generation of our country. I remember so many years ago when we were struggling, when we talk about generation again, during the 90s, I was on the road on West Street, walking. I didn't know what was it about. Today, we are the older generation, now we have to look at our own economy. Children, stop them from being illegal drug in our country. Thank you. Mr. President, I'm looking right here. Your Excellency, Joseph N. Walker, you promised us that you will make sure that you are beyond the plan. You promised us that you will back on the global stage. You promised that you will unite us. It's one of the things that divided us right now. It's one of the best places you have to unite us. Children are dying. This country is dying. We have a lot of people. So many people who put on their feet. Look at them today. And we're surrounded. Foreign coming in our country. We're going to give those send anybody send our children. Mr. Police, Mr. President. Those who bring their drug into our children, for God's sake, go after them. It was poverty to make sure. And I tell you what, Mr. President, whenever woman in anything, that bring women, they are strong and will make sure the thing work. And we in the diaspora, we promise you, we'll be like people to friends. Thank you so much. I want to take all the time tonight. We will make sure at least we'll raise funds. If you have medical doctor tonight, please volunteer to go on next year. If there's somebody who you got pharmacy, you got access to drug, anything from Thank you. God bless you.
Thank you, Honorable Keita. Ladies and gentlemen, you just heard the voice from the president of ULAA. You know, this is heartbreaking. This is touching. We are going to have a moment of silence. We're going to have a moment of silence right now. In honoring those who lost their lives to this dirty abuse, this drugs abuse, drug addiction. Let us have one moment of silence. Okay. Our heart is said, when women rise, something must happen. And we will not give up until we see results. Mr. President, government officials, we will not stop talking until we see changes, we see policy being revisited, we see implementations, we see support to these people. We will not stop. Now, ladies and gentlemen, I am pleased to now welcome our moderator that will continue from here, Madam Olive White, our second vice chairman, State of Georgia. Madam Olive White, you are welcome. Thank you. Am I audible?
Sure, let them read the video play first.
While we are waiting, can you guys please turn on your camera?
This is the first ever youth ever arrested in the 17. The police got this kid, we don't know who informed them of 4 hours of drugs in the 17. Full house full of drugs in the 17. Now they are uploading these consignment from the vehicle. We're seeing it now. Let's see if we can speak to any of the officers that are on ground to tell us basically what this consignment was taken from. But we are informed that this consignment was taken from the Jackson town. The other authority is here, the police and security personnel are also here, making sure that this church is also safe and protected to be taken to Central Monrovia, where they will have it in a storage and it's also part of the drug security unit. They are also here. So, see for yourself. More concerns coming in. Just yesterday at the local street, there was an armed robbery incident in Kingsville. Today, the LTA and the Liberia National Police, along with the Tapao, arrested a huge quantity of drugs. Huge quantity of drugs. Yeah, it brought the District 17 Monterey County a very huge quantity. We don't know if it's on marijuana, cocaine, grass, food, or what is it. The LTA will unveil these substances to the media.
Madam Olive, you're welcome.
Good evening, everyone. Thank you again to the Mother's Touch. Our goal tonight is simple yet profound: to begin an honest, understanding conversation. This would not be easy discussion. It calls for courage to look closely at the realities confronting us as a nation as we focus on the theme say no to drugs. We also recognize the underlying issues that open the door to this crisis: alcoholism, limited access to education or employment, absence of sustained community support system. These interconnected challenges require us not just to come up with an awareness, but collective action and leadership grounded in sympathy and truth to help us better understand the current landscape of our drug crisis in Liberia. Our first segment this evening will focus on national leadership and frameworks. We are deeply honored to begin this important conversation with our subject matter expert on national policy and enforcement, Mr. Honorable Biago, officer in charge of the Liberia Drug Enforcement Agency. Here tonight to introduce our guest is Madam, our first financial lead, Madam Mina Kato. She will be introducing our first guest on the panel tonight. Is Mina here?
This is Mina Cole. I'm trying to figure out what's her name in India. Let me find it quick.
It's Madam Mina. She's not. Oh, she's here, but she's muted.
I'm looking for her name. What is the name that she's under?
Probably zone user.
There's several zone users.
Okay.
If we can't find her, you have to go ahead and take action. And can we get the next?
Okay, so I will move on. Honorable Biago leads Liberia's foremost law enforcement agency charged with combating illicit drug. As OIC of the LDEA, he oversees national strategies to disrupt trafficking networks, enforce anti-drugs law, and strengthen community partnership in preventing and also the prevention and rehabilitation. So Honorable Bianco, welcome to the stage and welcome to the conversation. Is the Honorable in?
Yes, he is. Honorable, could you please unmute your phone? Please click unmute. I'm unmuting you. You have to click it on your hand, please. This is the part we say, ladies and gentlemen, we will be with you guys shortly. Honorable Bianco, I'm hitting unmute. It's asking me to unmute. Just hit the button that says unmute and you can come on to your presentation. While we're figuring that out, let me play the video some more. And I'll call you back. Years of civil war, 30 years of butchery, militias battling for power and control of Liberia. Honorable Director, I am clicking on your phone for you to unmute yourself, please. Okay, I need to reach you in the back. we can go to the next person, the next panelist, and then we will come back and work with the community.
Okay, so here to help us understand the national leadership and policy framework, we also have the health perspective. And the health perspective will be given to us today by Dr. Moses Zia, the second Director of Mental Health Unit of the Ministry of Liberia. And here to introduce Dr. Moses Zia is our attorney, Sonda Wilson. Sonda, are you in the house?
I'm here. It is my singular honor tonight to introduce the honorables, government officials here, ULAA president and officials, and Madam Chairman, as well as Madam Moderator, and all others following this very important program tonight. Dr. Moses Zia, who serves as Director of Mental Health at the Ministry of Health of the Republic of Liberia. Dr. Zia leads national efforts to expand mental health services, strengthen mental health-based care, and support the recovery of individuals affected by substance use and trauma. Ladies and gentlemen, honorables, let's welcome Dr. Moses Zia II. Thank you very much.
Thank you, Attorney Wilson.
Dr. Zia, could you unmute yourself? There you go.
Well, greetings, everyone. Are you getting me?
Loud and clear. Thank you.
Okay, good evening, good morning, good afternoon, depending on where you are currently. It's great to be here. So I bring you warm greetings from the Ministry of Health, and specifically my boss, the Honorable Minister of Health, who could not be here due to some really engaging activities for which he has asked me to proceed. Also, it's a warm, happy World Mental Health Day to all of you. Today is the 10th of October, and that means it's World Mental Health Day. As we know, mental health, substance abuse, neurological disorders, they are all a single unit under the WHO. So it's what we call MMS. So everything we're talking about, is just wrapped around each other. It's good to share with you that Liberia has been on a journey to improve services, a journey to leave where we've been for a long time, because we can certainly do better. A journey that is asking all of us to get involved, an initiative that requires all of us being involved. So I'm particularly grateful that Liberians in the US have seen the need, particularly our mothers, have seen the need to not just sit and watch what's happening in Liberia, but to come on board and to bring in whatever resources, from human resources to whatever existing resources that we need to tackle drug as a country. I think the highest office of the land, the president's office, and the president himself has seen the need that Liberia should tackle drug, and that's why he declared public health emergency, has called on the entire government and Liberians together to tackle drugs. So since his declaration of the public health emergency, Liberia has made tremendous gains along the way, starting from the very day that the announcement of the declaration was made. So my boss, the Honorable Minister of Health, who currently chairs the multi-sectoral steering committee on drugs and substance abuse, has been very, very passionate and very devoted to tackling this crisis. And she has demonstrated the leadership by ensuring that all the agencies that are relevant, including civil society organizations and everyone else who's relevant to this fight, have been brought on board. If you remember, the president announced 6 ministries and agencies But currently, our membership, the multi-sectoral steering committee on drug and substance abuse, is way beyond the six original entities announced by the president. It states to the fact that the honorable minister is quite cognizant of what this fight entails and that she needs all hands on deck. And as we kept repeating today, all hands on deck, that's exactly what we're doing as a country. Over nearly 2 years now, we've made a lot of gains, ranging from prevention on the side of demand to ramping up and improving efforts on the side of supply. So I think we are all in social media era. We see a lot of time what's happening in country. We've made a lot of efforts as it relates to all the interventions. So we've been doing a lot of prevention work. And we've been doing a lot of also treatment and providing rehabilitation services. From time to time we provide those updates. I will just let you know what the entire structure is like, because one of the things I heard when you asked me to speak has to do with the policy framework or what we're doing as a country. So currently, we're very proud to inform you that Liberia has, for the first time, developed a national anti-drug action plan. And all of these interventions, when we do, we often share on the social media space. So the Ministry of Health official Facebook page have been carrying these updates. But Liberia will develop a national anti-drug action plan, which is the first one that we have as a country. And so just to give you an insight into what we've done and what is supposed to lead the fight going forward, I'd like to inform you that this plan, which has been validated officially now, we are just in the process of completing the costing framework so that we can use it as an advocacy tool to be able to gather the right resources to expand current interventions that we're doing as a country. So looking at the plan, there are three strategic pillars. And the first pillar has to do with drug demand reduction. So at drug demand reduction, we have two priority areas. These priority areas, as we outlined them, will give you a little hint as it relates to what we've done so far, what is going on, how well or how more we can expand those interventions. So priority area one is prevention and education. So as you know, drug crisis. Hello? Can I continue?
Yes, go ahead.
Okay. So as we know, the fight against drug is not an easy fight, and that is why the countries in the United States continue to grapple with drug abuse year in, year out. So we all should realize that it requires a lot more than just the things we say, and that if we assert our best effort, it means that we have to be consistently devoted to what we are doing to overcome the crisis, because it is not an easy fight, but we are committed, certainly. So when we look at prevention education, we know that it's way cheaper to prevent drug use than it is to treat. So this has a massive aspect that has to do with prevention and education. And so things that we are concerned about doing here include school-based programs. Okay, we also talk about community-based prevention programs, school-based prevention programs. We're talking about mass awareness campaigns as well. And then we also talk about family support and prevention programs. So we know that, again, families have crucial roles to play in prevention of drug use disorder. So those are strategies that we have. So priority area one talks about prevention and education, and those are the strategies in general. I wouldn't go too much in depth because of time, but along these lines, we've been making a lot of strides. We've been having a lot of school-based programs. We've been developing groups we call health clubs within schools that will help the issue of peer support, peer education, peer prevention initiatives. So we've been doing school-based clubs or school health clubs, as we call them. We've been doing a lot of education work as well in school. And one of the landmark things we've been able to do recently, which we will be trying to complete, is the fact that we're able to develop a school-based manual, which is a mental health and substance use prevention manual to be incorporated or integrated into the national school curriculum. And as we speak, the Ministry of Education and the rest of the team, the entire committee is now working on how soon we can get that up in the national curriculum. So that's just an example of some of the interventions we're doing. We continue a lot of awareness campaigns and all of that. Priority area 2 has to do with treatment, harm reduction, rehabilitation, and reintegration of people with drug use disorder. Now, again, this is a very expensive priority area. The treatment of drug use disorder is quite very expensive. In Liberia, currently, unfortunately, the country does not have the infrastructure as a government to provide interventions or to begin treatment. But this is something we're very much committed to. So, currently, there are renovation works ongoing for public facilities to be converted into rehabilitation centers to begin. Some people directly being cared for public health system or through public institutions. So renovation works are ongoing in different parts of Liberia. We have at least 2 different facilities that are currently ongoing. One is currently ongoing, one is expected to begin soon. Also, we're building a new facility which is going to help as a national referral neuropsychiatric hospital. This current project I'm mentioning is currently ongoing. We just finishing phase 1 of that project. So infrastructure-wise, you need infrastructure to do treatment. Unfortunately, this is something the country has not had for all these years. So we are now developing this infrastructure. But at the same time, we cannot wait for infrastructure to finish before we start treating people. So what are we doing? We are partnering with existing treatment programs or organizations in Liberia so that we can continue providing treatment while we develop more infrastructure for the work that has to be expanded. So currently we're in partnership with an organization called the Mother of Light. It's based in Lebanon. Branch was established in partnership with the Ministry of Health, the national government. And now we are treating people along Grand Bassett Highway. It's an inpatient rehabilitation center that is directly run in close partnership with the Mother of Life and the Ministry of Health. However, we continue to work with the service providers around the country. Sorry, somebody got here. Okay, so currently we are working with that institution, that organization, to partner as a Ministry of Health to provide the care we're providing in that place. For those of us who understand the technical details, is based on the therapeutic community intervention. So it's an inpatient rehabilitation program that we designed to last between 6 to 9 months. But there's a process of getting there, all of that. And that process actually starts from the outpatient setting. So we're able to work with people in the outpatient setting, then prepare them, and then we determine those of them who would need long-term residential treatment. We're able to put them into treatment. Like I said, that is just one institution that cannot cater to everybody. So what we've been doing as a Ministry of Health also is to work with current providers who are NGOs or individuals that already provide care for substance use disorder clients or people with substance use disorders. So we've been working with them over the time to train them, to work with them closely so that they can improve the quality of care they are providing. For some time, a lot of entities have been doing what they felt is okay. And I know that same problem exists in the US. There are multiple entities rendering different help to people. Some of them evidence-based, some of them not the best evidence-based intervention, but they're trying to help. So we as a Ministry of Health, we can work with these entities so that we can give them the skill, give them the competence that they can gradually improve the care they provide. So in terms of treatment, we're doing that. More recently, we're able to get another facility quickly activated when we have increase in the number of ghetto rates and the number of drug users who were hoping to get into treatment. So currently, we've been able to activate a facility in Johnsonville owned by the RC, and repatriation and resettlement commission entrepreneurs. So we're using the facility, and we have a number of people with substance use disorder in care. We have very committed and dedicated staff from psychiatrists, clinical psychologists, clinical social workers, nurses, mental health clinicians, and so forth. They're there providing care. We're using that center as points of initial rehabilitation. So more than we have people that we initiating the process of rehabilitation, and then those who can be transferred to the more stable, more organized inpatient rehabilitation center in Buchanan, we can move them there. But they are receiving care as well. Again, the evidence is one thing we're insisting on. So the programs that we are running, we're ensuring that we're going clearly by based interventions. So that is on the side of treatment. We continue expanding treatment interventions, and like I said, the country is currently in the process of renovating a number of facilities, public buildings that we can convert into rehabilitation. So on the issue of harm reduction and other things, we clearly are looking into other programs. This medium will be one great way, great means by which we can advocate. We're looking at other interventions for drug use disorders. And by the way, what is happening in West Africa now, we believe is consistent with what's happening in Liberia, is the fact that new psychoactive substances are being discovered. So the UNODC has been able to do some study in Sierra Leone, which is believed to be the source of the kush coming to Liberia. And that study reveals that more than 80% of the kush that they have tested are what is called nitazene. And those of us in the field understand that nitazene is a highly potent, highly dangerous opioid, which is even more potent than fentanyl. So they are very potent in the economic block. It's a fact that we have. So it means that what we have in the area include nitizenes as well. And from the clinical picture of people with substance use disorder, we've been seeing recently the overdose there. All those things we've been seeing rapidly increasing of late. We have reason to believe that we're dealing with an opioid crisis as well. Although specifically in Liberia, we've not been able to test the active ingredient, but we have reason to believe that it may be the same nitazene from Sierra Leone. So if we're dealing with that, you please understand how we are more inclined to design interventions, including replacement therapy, which is the big thing in the US right now that's helping. Helping with crime rate, helping with overdose prevention. It helps a lot of ways. But unfortunately, in Nigeria, we do not have at the moment such intervention, opioid substitution therapy, or medication assisted treatment intervention. We do not. So currently, we're making efforts to establish such a program in Liberia. Most of the contacts, most of the people we get in touch with is against that backdrop to be able to bring other treatment interventions there. Integration, of course, all of these things they're really important. We see that a lot of young people are unemployed in Liberia, unemployment, poor educational status, a lot of things are there. So this anti-drug action plan is clearly giving a roadmap. When we want to fight drug, we can just look at one aspect. So the Ministry of Gender, the Ministry of Youth and Sports, a lot of other entities have been asked, clearly, to be able to design interventions to help with social integration. So we need the advocacy, we need the money, we need the funding to be able to make those, institutions or those resources available when we start treating people so that they don't come back in the street. Because one of the troubles we've seen, you treat people for a number of time, they're doing quite well, but then there is no safety net. They come out, the parents in home, many of them now have homes to go to. We do not have the luxury of, getting social services like other parts of the world. So we are clearly intentional about this action plan addressing issues like that. Quickly, to run through, the second strategic pillar is drug supply reduction. So on drug supply reduction, we want to make sure we block the entry of these harmful substances into our country. At the same time, we want to prevent the production of those substances in our country as well. Because those are all in the field, we understand that many of the traders or traffickers or dealers, sometimes they don't bring the finished product itself, they bring the precursors. And because those precursors may not control measures, they are able to bring the precursors and they can open labs in the country and start producing those harmful substances. So clearly, our intervention as guided by this action plan is to ensure that we have thorough law enforcement and control so that we can interdict all of these substances from coming into our country. So priority area 3 is law enforcement and control. We are looking at how can we get technology involved, how can we get more manpower at the borders, how can we man the borders more. We're talking about drones, we're talking about scanners. One of the things we'll also talk about includes the issue about setting up K9 units, those K9 dogs that can help with security in major areas. So those are all things we've clearly indicated in this action plan. Now, priority area 4, we talk about control and regulation of medical controlled substances. Now, we know that if you look at the US history of how opioid became a problem, it came clearly from over-prescription of opioid medications, and other control drugs. Now we are being intentional, very intentional, to see how we can implement prescription-only intervention in Liberia. You know that most of us know that you can practically go to any pharmacy in Liberia and request anything and you will get it. So this action plan is clearly outlining how we should design and tighten control and regulation of these medical control substances and their precursors. Priority area 5 is looking at legal and judicial reform. So we talk about the drug law, we talk about the LTDA Act, we talk about what kind of laws do we need? Do we need to review our laws? Do we need to do something else with the laws? Do we need new laws and guidelines or so? So this action plan is clearly giving us a roadmap how we should proceed. Then the final strategic pillar has to do with governance, coordination, and evidence or decision making. Here, we're concerned about how well we can coordinate all these efforts because we have drug supply. If we do not coordinate properly, we do not, declare governance, then that's a problem. So the third strategic pillar of this action plan is to ensure that we have good governance, coordination, and we need evidence. So priority area 6 is talking about governance, policy, and coordination, talking about the different levels of leadership, the policy issues, and all those things that how can we align policies, existing policies, and national government policies to reflect what this action plan wants and what we want to achieve as a country as it relates to the fight against drug. And priority area 7, which is the final one, talks about research, monitoring, and evaluation. Now, the issue about data for decision making cannot be overemphasized. We say a lot of times in Nigeria we do not have data. Most of the things that we're doing, we're based on anecdotal evidence. Those of us who are clinicians, those of us who have experience in different things, we use our experiences to inform decisions. But it can take better. If we're able to do a lot of research, we're able to explore, different things, we're able to, update our decisions, and we're able to make the best possible decision. So monitoring, evaluation, all those things that are needed to implement a program, those are the things that, this priority area covers. So in general, we have 2 now, which is this anti-drug, the National Anti-Drug Action Plan that's clearly going to give us, that direction as a country and bring all the stakeholders on board. At this moment, the Ministry of Health knows exactly what it's supposed to do. The FDA is supposed to, knows exactly what it's supposed to do. All the other entities will know, but beyond those entities, does the country know what we are trying to achieve as a country? This is the tool that we developed. This is the action plan that's going to help. You can be in the diaspora and just look at what we're trying to do, and based on your network, based on what resources you have, you can say, what, we can contribute towards this priority area, and we can make some gains along here. So I'm happy to be here, and I'm happy to share, a bit of what we're doing as a country. Again, if there are questions, I can take them. But we want to say thank you to everyone in Nigeria who keeps doing, to push this fight. The LTDA, I know we've seen of late, we've been doing a lot, we've been seizing a lot, we've been doing a lot together. And I think we can do better. Thoughts at this moment, and turn it over.
Thank you, Madam Olive. Unmute yourself, please. You're unmuted.
Okay, so next on the list here, do we now have?
To tell him thank you for speaking.
Okay. Madam Chair, go ahead and say the thank you now. Are you?
No, go ahead. Sorry.
Go ahead.
Oh, I thought we were talking in English. Sorry.
Guys, Tazia, we want to thank you again for that remarkable presentation. I mean, everybody followed, everybody was listening to you. I was there giving you all the thumbs up. I think that's what I just got caught up that I already said thank you. So we're gonna move on next. Do we have the LDA Honorable Biaco?
Yes, we're gonna have him, but the gender minister, she has something to do, so she would like to go quick before he comes back. But we got him. So she will be next, please.
Okay. So here to understand, again, we are still here on our national leadership and policy frameworks. So here to understand children and protection services, we will call on our next subject matter expert, Honorable Carmen Saros Video, Deputy Minister of Gender and Children Protection Services, here to introduce Madam Gamen will be Madam Tene. Miss Tene, are you here?
Yes. I just wanna make correction. She is the minister proper.
She is okay. Minister. I'm gonna Madam Gamen, my apologies. The minister, not the deputy. She is the minister. Okay. So the Miss Tene, are you ready to usher in our minister of Gender and Children and Protection Services, Madam Carmen Sarah's video? Thank you. I think Miss Tene is ready. Yeah. Thank you.
Madam Bano is the Minister of Clinical and Substance Use Recovery Professional in Monrovia, Liberia. She is a dedicated mental health clinician working with individuals and families affected by substance abuse. She champions holistic recovery approaches that address both medical and social dimensions of addiction. Thank you.
She's muted. Thank you. You have to call the minister. You have. Can Fatimata please introduce the minister proper, please? Okay. Madam Minister served as the minister proper for Children and Protection Services in the Republic of Nigeria. She's a committed public servant. She's an advocate for the rights and protection of women and children while shaping policies to address gender equality and social welfare. Her leadership focuses on safeguarding vulnerable population and strengthening Liberia's response to issues affecting families and communities. Thank you. I think we got a little mixed up, but thank you, Tenet. Yours is coming next, so we'll move to the minister. Thank you so much. Yes, the minister is unmuted. Can you reach back to her? Can she?
In the interim, is there any question thus far based on what we have heard while we're trying to locate the minister? If you do have any question, please put that in the chat box so we can start asking the prior speakers those questions for answers. Thank you.
We all be right.